Well, I'm O.P. Yadav. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Whenever we do manual surgery, we have a big disadvantage of tremors in the hand, which cannot be zero in any human being. To avoid those, robotic surgery was introduced, in which robots perform the function of the human hand with equal dexterity. Today, the robots in cardiac surgery are being used essentially for two purposes. One, to take down the conduits, especially the internal mammary artery, and then the anastomosis is done manually, or in a second format, what we call TCAB, or total endoscopic coronary artery bypass, which is also in some places called EndoCAB, in which the entire surgery, including the anastomosis, is made robotically. We have now the 4th generation robots, and after initial lag period, we find robotic surgery is gaining traction, and the motion of the heart has been nullified through the experience with beating heart surgery, and the tactile feedback that we are getting now through the robotic new arms is making robotic surgery very much feasible even in the field of coronary artery.